My name is Dr. Marie. I'm a family chiropractor, and I take great interest in helping mom to recover from pregnancy and delivery. And today we'll be talking about diastasis, how to restore integrity of your core muscle, and we're even going to touch a little bit on Kegel and pelvis floor muscles. So first of all, let's define what is a diastasis. So diastasis is the separation of your rectus abdominis. So that would be your six packs, and then that would be the line in between, and then when they spread. So obviously, as you remember, when your belly was growing, everything was starting to stretch and expand. So often what happened is that line in the middle that we call linea alba, that's connective tissue, gets stretched out, and then because it's fascia, it's connective tissue, it's not as easy to go back, and then it can leave women with a separation. But actually diastasis, it's just the term to say that it's separated, but it's not only for pregnant women. Like you can see this in athletes, and you can also, like more bodybuilder, and then you can also see this, actually your baby, depending how old your baby is, it most likely have that same separation when they start like kind of crunching. You can see that like the belly is gonna do like a little dome, and that's because the soft tissue and the connective tissue is not strong enough to hold everything. But as your baby, as they're going through their milestone and developing their stability and their muscle, they gain more stability, and then it closes. So we can do the same thing for you. We can help you to restore integrity of your connective tissue on your core muscle and bring more stability so your separation heals. Now, there is a different kind of diastasis, meaning you could have one below your navel, you could have around it, and you could have one above, and you could also have one that cover the entirety of your rectus abdominis, unfortunately. But the idea is that we want to bring more functionality, restore the integrity of your core muscle to allow the muscle to come and reach back again in the midline. And to do that, now we need to start understanding more about your core muscle. So often, I mean, I hear this all day long coming from people with back problem, that they talk about, "Oh, I know, doc, I need to strengthen my core so my back won't be giving out as easily." But when people say I need a stronger core, they often associate this with I need a stronger pack, a rectus abdominis, and actually and then now they start thinking I need to start doing crunches. But crunches is not going to actually heal your diastasis, and it's not going to bring integrity back to your core muscle, because it's only one muscle, your rectus abdominis, and actually, really, to be honest, it's not that strong of a muscle attached to your rib, the bottom of your rib cage, and then goes to your pubic symphysis, and so they actually don't offer much support or part of integrity in your core muscle. So core muscle, think about it like it's a box, and a box, so we have a top, and that would be your breathing diaphragm. And then we have a bottom, and that would be your pelvis floor muscle. And then we have a front, which is all your abdominal muscle, not just the six packs, not just the rectus abdominis. So you have the transverse, you have the obliques, and then you have the rectus abdominis. And then all those like transverse and obliques, they all like attach to your midline with that connective tissue that we talked about, the linea alba. So we have like 3 layers of connecting tissue that ended up being stretched, and that's why that created the diastasis. And then finally, to close our box, is our back muscle. Back muscle, like your erector muscle, and then multifidus, your QL, and then there's even accessory muscle with your glutes and even your latissimus muscle. But let's focus on the main box. So like I was saying, like focusing only on crunches and your rectus abdominis actually will not bring integrity and functionality to, and that would lead to stability to your core muscle. What we need to do is start with the basic, and it's your top and bottom. So we want your bottom and your top to start moving together. So this is often become desynchronized through pregnancy, because as our belly grow, we move away from a belly breathing to a chest breathing. So you like it just, because you get big, so you're like, how much more expansion can I do? Okay, so but actually a lot of people doing a sitting job end up with a similar issue, and then people that are stressed, and then that causes a lot of actually neck problem. So we end up like doing a lot of short, shallow breathing. So what we want to do, we want to bring the motion of your diaphragm and then to have it move with your pelvis floor muscle together. So how to do this? I like to help people doing this by using their hands. So right now you could go ahead and take a breath and kind of notice like what's moving. If your shoulders are moving a lot, that's a hint that you are like a chest breather. So what we can be doing is putting a hand on our chest and putting a hand on our belly, and then we want to be focusing on only your hand on your belly to be moving. So as you're breathing, so if you start like doing this, then you can notice that actually I am recruiting other muscle that shouldn't be there. So the first actually exercises to do is to bring your awareness to your belly, to your diaphragm. So as you breathe in, the air comes and fill up your lungs, your diaphragm goes down, and then that's what it push your belly out. And then as you breathe out, the contraction of your diaphragm push the air out, and then the belly comes in, okay? So just like this one going up and down, we want to do the same thing. So now if you bring more awareness to your breath, now let's actually bring a second step to this, and that would be to bring your visualization of your diaphragm moving in sync with your pelvis floor. So as you breathe in, you visualize your diaphragm going down, and then your belly out, and then your pelvis floor that goes together, but your pelvis floor muscle going down at the same time. Like this is an exercise that it's best done sitting down. So sitting down straight, like sitting on your sit bones, and then you can practice. And you do like a 5 breath or so at the beginning. If it's something that you have moved away from, like a belly breath, it's something that might be difficult. So 5 breath would be what I would recommend. And as you get more familiar with it and more comfortable with it, you can move up and start doing more breath. And also, like sometimes if this cue of hands is not helping, you could also put your hands around your side ribs, and then imagine that your chest is expanding and then pushing like the belly around, a bit like an umbrella opening. Right? And then this one's depending of your comfort level, like my shoulder moves a little bit, but you really want to focus on the expansion this way. So from here, actually, I'm going to show you the same breathing exercise, but lying down, and then from there we'll be able to talk a bit more different engagement. All right, and now let's review our breathing exercise lying down. So here we're going to deconstruct like the exercise that I want to show you. So the first one was the breathing part. So one hand on the belly, one hand on your chest. And then we want to focus on bringing our hand on the belly to move. So don't think that you have to take this humongous breath. Just focus on the motion, keeping this one stable here, and seeing your diaphragm going down and your pelvis floor going down as you breathe in, and then in as you breathe out. So this one here, this position doesn't have like much gravity, so it could be the easiest way to introduce this belly breath, especially if you're finding yourself like out of breath or like having a hard time to catch enough air in. And then just focus on doing 5 breaths at the beginning to get more comfortable. And then now, the second part of this exercises would be to move our hips. So we want to imagine that those are your hip bones here. We want to imagine that they are moving backwards, and then we're going to bring our spine flat on the table. It's easier to do this on a harder surface, but if you have to do it in the bed. All right. So yeah, flat on the bed or the surface, on the floor, and then we're going to go the opposite way. You're moving your hip bone forward and trying to arch your lower back, and then here like creating some space. So here again, let's try to focus on this area of our spine and try to move as little as possible our chest. So not trying to arch with all our chest, but rather more leading with our hips. So it's easy sometimes, easier I mean, to use our hands on our hips to kind of guide the motion. And at the beginning, it could be really small. Like you don't need to do like a huge wave. It's just to start isolating that motion. Now let's bring it with our breathing. So as we're going to take a deep breath in with our belly, we're going to arch our lower back and create that space. And then as you breathe out, you're going to bring your spine back on the table. Right? And then we're going to breathe in and arc, and belly out, and then belly in, and then go flat. So now, we talked earlier about our transverse abdominis, and that is the one that is going to bring the most support to your core muscle. And then now, when you feel comfortable, so you could be practicing this for a few days, like rocking back and forth, and you're breathing like for 5 to 10 breaths. Once you start to feel strong with that motion, now we're going to add the engagement of your abdominal, abdominal muscle. So again, we could locate our hip bone here, and then you can go almost like inside a little bit more to the soft tissue. And so we're going to take a deep breath in and arc. Then you're going to breathe out, and then bring your belly in and go flat on the table. And then here, I want you to try to contract where your fingers are. So almost like bringing like your pubic bone forward, like you really want to focus on this lower part of your belly. So again, so sometimes when we start to add the contraction, people just start getting everything crampy, and then again recruiting the chest or even the lower part. But we really want to engage your transverse abdominal, which is a little bit lower on the hip. And then for some people, if your transverse hasn't been engaged or hasn't been participating like it should, it might take a few seconds, and you might actually not feeling any contraction. Like a contraction under your finger would be feeling like the muscle almost push up your fingers, and then feeling some tension. But for some people, it might be really hard to feel at the beginning. But keep doing it, and then visualize, try to engage almost with your mind at first, and then hold the contraction. And then so the goal would be to start engaging kind of right away instead of a few seconds, 3 seconds in, and then that's you're gonna know that your muscle is getting stronger. And then once you do that, this is your foundation. And then now when you do exercises or workouts on the floor, you will be able, this is how you engage your core muscles. Sadiano's helping us, is cheering us on. Please engage your core muscle. So when you say engage your core muscle, it's not just getting everything cramped. It's actually doing this motion really fast, and then getting the lower part. And then now you can be doing any kind of stretches, exercises that's going to be working other muscle, other core muscle. And then but you have your foundation. And then once you feel comfortable